The body's GPS. How anatomical directions keep surgeons alive. When surgeons step into the operating room, every movement has to be exact. There's no left-ish, no kind of above the knee, and definitely no guessing. So how do medical teams stay perfectly coordinated? They rely on the body's very own GPS system, anatomical directional terms. And today, in just a couple of minutes, you'll learn how these simple words prevent life-threatening mistakes. Why this matters. Imagine a surgeon tells a resident, make the incision lateral to the sternum. If the resident mistakes lateral for medial, they could cut toward the heart instead of away from it. That one misunderstanding could be deadly. This is why anatomy uses a universal language, precise, consistent, and understood the same way across the world. The starting point. Anatomical position. To use this GPS, everyone must start from the same reference point, the anatomical position. Standing upright, facing forward, palms forward, feet slightly apart. Even if a patient is curled up in bed or lying sideways during surgery. Directional terms always refer back to this standard position. It keeps communication clear, even when real bodies aren't so neatly aligned. The body's GPS directions. Now let's run through the essential directions. Superior, toward the head. Inferior, toward the feet. Anterior, toward the front. Posterior, toward the back. Medial, closer to the midline. Lateral, farther from it. Proximal, closer to where a limb attaches to the body. Distal, farther away. Superficial, near the surface. Deep, farther inside. It's simple, but these words let healthcare professionals describe any structure in the body with absolute precision. Real medical example. Picture this. A paramedic radios in. Patient has a deep distal laceration on the anterior right forearm. Instantly, the emergency team knows. It's on the front of the forearm, farther from the elbow, and the cut goes into deeper tissue. Before the patient even arrives, the team is already preparing the right tools and treatment. That's the power of speaking the body's GPS language. Why you should care. As you begin your journey through anatomy and physiology, these terms will anchor everything: body regions, imaging, organ systems, and surgical procedures. Mastering them early is like unlocking the map that guides the entire course. So the next time you hear lateral, proximal, or superior, remember, these aren't just vocabulary terms. They are the directions that keep medical teams coordinated and patients alive.